Good morning. Thanks for joining us today for our webinar entitled Assessing and Working with Anger Issues in Young People. My name's Karen Marriage and I'm a clinical psychologist who works here at Orygen, the National Centre of Excellence in Youth Mental Health, and I'll be your moderator for this morning's webinar. So today we have Alex Parker talking with us about working with anger issues in young people. And I think those of us who have worked clinically know that this is a very common issue and that many people who are referred to us for various presenting problems will have difficulty in managing and expressing their anger. It can be difficult to treat and it can pose some clinical dilemmas for people who are wanting to work with young people who are angry. But it poses a lot of difficulty for young people who are angry themselves. How they express that anger can make life very difficult. So I think it's an issue that many of us who work clinically are faced with, and this is a nice opportunity to pause and have a think about how we go about assessing these issues, treating them, and what does the evidence tell us about what we could be doing with young people who present with anger issues in our clinical practice. So we have Alex Parker presenting with us today. Alex is a Senior Research Fellow at Orygen, the National Centre of Excellence in Youth Mental Health. She's a psychologist and Senior Research Fellow who has been involved in early intervention research and worked in youth mental health services for the past 10 years. She also leads the Headspace Centre of Excellence, operated by Orygen, and is leading a major Australia-wide investigation funded by the NHMRC into the effects of incorporating physical activity into the routine clinical care for young people with depression. So thanks, Alex, for presenting to us today. And people, please do send through your questions to Alex and we'll get to what we can at the end of the webinar. Thanks.
Thank you, Karen. Okay, so today with the webinar, as Karen mentioned, we're going to be looking through some of those questions about sort of understanding how prevalent or how common anger problems are with young people and the impact that it can have on their functioning and their well-being. Understanding the importance of the assessment of anger and the challenges and clinical dilemmas of working with anger as a presenting issue for young people. We're going to look at some of the skills involved in assessing anger and working through a framework of how to assess for anger difficulties in young people. And also to look at some of the interventions that aim to reduce the experience or expression of problematic anger in young people as well. So to start with, I'd just like to think about defining anger so that we're on the same page in terms of what we're covering in this webinar. So we're talking about anger as being an emotion that has got cognitive, affective and behavioural components. So the cognitive components can relate to the thoughts and attitudes that people have in relation to those events surrounding them and things happening around them. And then that's what influence what they interpret to induce anger. And it's usually associated with the belief that someone's done us something wrong or something wrong has happened. It's also an emotion that's closely linked to the autonomic arousal response, and so it can assist our body preparing to fight or flight, our fight or flight response in reaction to a perceived threat. And it also varies from person to person, so it may be from mild irritation through to intense rage. And it's also important to distinguish between the experience of anger and the expression of anger. So when someone feels angry, it can be expressed outwardly through their verbal or non-verbal behaviour, but it also could be suppressed, which means it may not be obvious to other people that someone's experienced anger, even if it's intense, chronic and persistent. And so understanding this common emotion can help in managing the feeling and helping people to express it in a healthy way. And what we think about in terms of problematic anger is that when anger is frequent, is intense, or it leads to other problems happening, and some of those other problems may be aggressive behaviour that's expressed by someone, increased risk-taking behaviours, increased self-harm, physical health problems that can be associated with having chronic anger, and stress and distress as a consequence of this. It may also cause some stress or distress in other people who are witnessing or involved in someone's expression of anger too. And anger, in terms of how it's experienced by people and the intensity that people do feel it, is considered to be a personality trait in a way. So thinking of it being on a dimension, so that some people, for example, might only ever be at the lower end of feeling mild irritation, whereas others are at the higher end and they're feeling that more prone to feeling intense anger more commonly than others. And when people are more likely to respond to situations with anger, sort of talk about that, meaning that they're likely to have high trait anger. So, and also so that's the intense and increased display of anger can be a problem, but then the opposite can also be problematic as well. So people who do experience anger but then suppress it have shown that it's got some challenges associated with it. So some people will find that it reduces their social support, their relationship satisfaction. It can also be linked with experiencing depression, physical health problems as well, and also likely to increase self-harm. So in some ways we're thinking about today focusing on when it's problematic in terms of how it's expressed, and also problematic when it leads to a range of other negative consequences for a young person. I thought we'd just address too some of the common myths about anger, because these do influence how we think about young people who are presenting to mental health services as well, and also influence how we talk to our young clients about anger issues too. So the first myth is that anger is a bad emotion. We like to think about it in a different way and say that anger is a healthy emotion that can have adaptive functions. So both the expression and experience of anger as part of healthy emotional functioning, but also learning to be aware of our emotions and knowing how to express them appropriately is also an important part of healthy development and good mental health as well. Also, research has shown that people who can learn to develop assertiveness and problem-solving skills to address any perceived threats or injustices that they may have experienced also actually may reduce their chance of experiencing depression and anxiety as well. So learning to cope with or manage and develop skills to deal with anger is actually an adaptive functioning skill. There's also another myth that it's easy to identify in others. You can tell when someone's got a problem with anger, and that people who experience anger are always frequently angry or clearly can show it. But we know that some people do suppress or bottle up their anger, and they're less likely to get help because of this, because it may not be apparent to other people around them that they are experiencing intense or chronic anger. And they still need support to manage that. There's also a myth that feeling angry is the same as aggression. So we want to delineate the difference between feeling angry and actually expressing the anger. So the aggression is a behavioural response, whereas anger is the feeling. And so aggressive behaviour is not always the result of someone feeling angry. It can be the result of intense other emotions as well. For example, some people who have intense anxiety can also exhibit aggressive behaviours too. Another myth is that it's only a male problem. Because there's lots of myths about gender and anger, and it's closely tied to different social rules about emotional expressions for boys and girls that exist predominantly in Western societies. So girls are encouraged to be more emotionally expressive than boys when it comes to most emotions, and boys are expected to express a bit less of these tender emotions, but more of anger or contempt or disgust. So as a result, girls may learn to suppress their anger, or boys learn to express it. But generally, the research doesn't support the idea that men experience more anger than women. In fact, recent research has shown that if a gender difference does exist, it's actually that women are more likely to feel angry more often than men. They may also experience more intense and enduring anger, but overall, the research does suggest that men and women express their anger in different ways. So men are more likely to display direct aggression, so physical or verbal aggression, than women when they're feeling angry. And this may lead to the assumption that women are then more likely to express relational aggression, so more subtle forms of aggression, such as manipulation in relationships or spreading gossip or things like that. But again, some recent research has shown that There are little differences between how boys and girls use relational aggression. So some of these ideas about it being a male-only problem tend to really relate more strongly about how it's expressed rather than how it's experienced. And the final myth that I'd like to to touch on is that anger problems may be seen as being less worthy of intervention than other difficulties that young people have. So there's the idea that it may be that, that people who have difficulty regulating their expression of anger are not as much in need of interventions as other issues. But we know with the whole range of negative consequences that are associated with it, including comorbid mental health issues, a whole lot of negative impacts on their social functioning, that young people who actually do have some problems with anger do need that support and that assistance in managing their emotional regulation. So the biggest thing about these myths is that they may delay access to treatment or services. So that's why we've touched on them today, so that we can be aware of them and to know what we may do differently when young people are coming to services with predominantly anger issues. So how do we detect anger issues in young people? What's some good ways of thinking about that? Well, the reason why it is important, we can actually look at some recent data just for a second that's coming from Headspace centres. So this is over 20,000 young people who've come in for a service, a mental health service from Headspace centres over the last couple of years. And the full data is available in the paper that you can see the reference there in the bottom corner. But what I've done here is have a look at the three main presenting issues that have been rated by clinicians when a young person has their first contact with a Headspace centre. And we can see across the age range that depression and anxiety are the most common issues, but particularly for males aged 12 to 17 years, anger becomes nearly on par with depression and anxiety in terms of how clinicians have assessed or rated their main presenting issue. So anger was the third most common, and then after that came a whole range of other issues that young people identified were they were having some difficulty with. So it is common, and it is important to assess when young people are accessing services. And why is that important to detect anger? So we know it's a common presenting issue. And it's not only to Headspace centres. Some recent data from CAM services, so from tertiary mental health services, have shown in Australia and also internationally that nearly a third of referrals were for anger or aggression to these services. And the prevalence is likely to be underestimated because we know that the majority of young people experiencing problematic anger do not actually seek support from services. And even when they do, in combination with some of those myths that we touched on earlier, they're unlikely to receive an effective intervention. Some of the reasons behind that is that clinicians have said they feel like they've got low confidence in assessing and treating anger issues, and that it's also difficult to determine appropriate referrals and entry criteria to services if anger is the main issue, because it's not a diagnosis. It sometimes can be a barrier to accessing services as well. But on the whole, we do know that clinicians, when asked, have actually endorsed the need to provide interventions because they are aware of that significant associated psychopathology when young people are presenting with anger, and also the impact that it has on young people's functioning and on those around them as well. So it's sort of seen as being something that we need to detect and do something about, but we're not uncertain as to actually what to do. One of those issues that I just touched on was because this difficulty of knowing whether anger is a diagnosable problem. And if it is the main presenting issue of someone, and it may mean that they can't access a service because it actually isn't a diagnosis. So it tends to be more commonly part of a complex clinical presentation. So it's indicative of someone who has some problems regulating unacceptable feelings as well. So if that's the case, it may well be that people who have strong feelings of sadness may feel like that showing those is a sign of weakness, and therefore more likely to experience that sadness as anger, or it triggers anger. And in this way, it also might, if it stems from other confusing feelings, when it functions this way, it can mask other negative emotions that are distressing to the young person. So it's always important to assess around those to see what else might be underlying the anger presentation as well. And also we know that in children and adolescents, sometimes depression can present more as irritable mood rather than sadness. So as a result, teachers or parents who are concerned about a young person might be describing them as being angry. So it's important to be aware that a young person who's experiencing anger may actually be struggling with depressive symptoms, and that happens regardless of their gender. So we need to keep that in mind too. And for some young people with high levels of anger or difficulties managing their anger, we need to also be aware that it may be associated with prior traumatic experiences as well. So to carefully assess around those issues too. And although it's limited, recent research is sort of giving an emerging picture that people presenting to psychiatric services with problematic anger as their primary concern are at risk of being misdiagnosed. And so that may result in inappropriate or ineffective treatment or the wrong treatment being offered or delaying access to treatment as well. So particularly for females who present with problematic anger, they're more likely or particularly at risk of being misdiagnosed with borderline personality disorder. And while males tend to be at risk of being misdiagnosed with antisocial personality disorder. So that's just a caution to keep in mind that a personality disorder should never be diagnosed solely on the basis of anger problems. And problematic anger is highly prevalent in clinical samples as well. So it is a diagnostic feature of conduct disorder, oppositional defiant disorder, PTSD, and borderline personality disorder. And it's also associated with depression, anxiety, and substance use. And that substance use might be a way of coping with some of those underlying emotions that are driving the anger. And so because of that, we know that many young people would benefit from support in understanding and managing their anger, even if it isn't a diagnosis. So assessing for problematic anger. So suggesting that there needs to be some screening at intake for clinical services, and there's a variety of reasons for that. Again, we've mentioned that it's highly prevalent, so we know the chances are that a young person, a lot of young people are going to be experiencing problems with anger or managing their anger. We also know that unidentified or untreated anger may jeopardise treatment outcomes, so it does have an impact on how other difficulties are treated if we're not actually aware of anger being part of the mix. Assessing around anger can also help to detect any other underlying emotional difficulties. So as we mentioned before, that there may be some other reasons that are driving that anger, so around mood or anxiety issues as well. And we also know that treating problematic anger may actually reduce suicide risk. So suicide risk is associated with young people experiencing problematic anger. And so if we detect that they are, then we know that we can actually offer them the appropriate clinical response to any risk issues that they're experiencing as well. So we'll talk through a framework that we have for assessing anger in young people that present to clinical services. So the important thing is to consider to start with is to not to assume that young people will spontaneously report their anger problems. So we do need to question and ask them about it. We need to ask about their experiences of feeling angry and how they manage their anger, even if their anger isn't identified as a problem at the referral, in the referral. And to remember that anger problems are prevalent in young men and young women, so not to have a gender bias around asking around anger issues. Be mindful that young people, and particularly younger adolescents, often struggle to recognise and understand their anger. So try to support them to find a way to describe their emotions. They may even think about asking where they feel anger in their body as a starting point. And also young people can be ashamed to talk about their anger issues and the consequences that it's had for them too. So to validate their emotional experience and to maintain a non-judgmental approach when you're talking, when you're doing the assessment with the young person, as you would with any other issues that arise from assessment. And for a young person, once you realise that they're having some difficulties with managing their anger or expressing their anger, is to never assume a diagnosis, as we mentioned, if anger is a predominant symptom. And don't pathologise anger or assume that it's maladaptive. So a way of doing that is to try to explore with that young person about the situations, emotions, thoughts and beliefs that actually trigger their anger. So try to think about, is it different in different situations? Are they engaging in certain behaviours to try and regulate their anger, such as expressing it with aggression or self-harm or risk-taking behaviours? Ask them what helps them to manage their anger and explore areas of their personal strength at the moment. Need to consider that there may be a trauma-related or abusive history there, so to actually ask about those symptoms and also know what services you can refer to if you do need to do that, depending on what comes up from that as part of the assessment. It's really important to inquire about their substance use. So as I touched on very briefly before, it may well be a strategy that they use to try and manage their anger, but it also may well be that it exacerbates their anger or their aggressive behaviour as well. So to understand any relationship between anger and substance use is really important as well. And the last thing is to think about assessing their readiness to change and to match their interventions appropriately. So it can take some careful work to start with, because we know for a lot of young people, the reason why they've come to services if they're experiencing anger is not so much that they're concerned about how they're expressing their anger. It's more about others that are concerned about how they've been witnessing or been part of or being really concerned about the young person in the way that they're expressing their anger. So sometimes it can be that a young person hasn't actually self-referred, and so again, it's keeping those ideas, those things in mind when you're working with and trying to engage with working with a young person. It's really important with anger to also consider how you will assess around risk. So risk to self and risk to others as well. So we do know that those who are experiencing problems with anger do tend to be more likely to be engaging in self-harm, suicidal ideation or suicidal behaviours, and also have some general safety concerns. So to assess around those issues is very important. And also to assess around their history of violent behaviour and risk of hurting others. So this can also be a tricky area to get into, and so there's a couple of assessment tools that may be useful to support clinical judgment, but they do require some training. So I've just mentioned what they are there. So we've got the SAVRI and the HCR20 that can be used, and then they can actually identify some of the triggers and risks and also the issues that young people are having, and use to actually feed back in the formulation with the young person about their current difficulties and what would be the best treatment approaches for managing those. But just to bear in mind too that these tools are actually, they support, as I said, support professional judgment, and they actually assist in assessing the probability that someone might engage in violent behaviour and identify those risk factors. So they're not a replacement for clinical knowledge, but they're also just about the probability that something will occur. So to bear that in mind as well in the way that you feed that back to a young person. And we're thinking by identifying any manageable or modifiable risk factors, for example, the use of substances, looking at whether they've got problems with impulse control or ways in which they're coping with stress and managing that. All of those, if we identify them, we can actually use them to help manage those risks appropriately with the young person as well. And just as a final point on the risk assessment, we just wanted to mention too that any immediate risks of safety to young person or others, if they are identified from the interview or from your assessment process, to remember to take immediate action within your organisation's risk management policies or your professional guidelines regarding duty of care in this issue, to protect and warn individuals who may be at risk of self-harm or self-harm. Another part of the framework is to have a think about the assumptions that you may hold about anger, and do these influence your ability to detect and work with young people who have anger problems. For example, do you associate anger with a particular diagnosis? Do you feel comfortable working with clients presenting with anger problems? And how do you manage your own anger? And so we suggest, like with any complex clinical issues, that you use supervision to work through any relevant issues, and you can seek extra support and training as required as you work with young people with anger issues. So I'll have a look at some of the interventions that's available with young people who are experiencing anger. So why would we think about trying to offer interventions within an early intervention framework with young people with anger difficulties? So we do know that there's a significant amount of distress and functional impairment in young people who experience chronic or intense anger or who have difficulty in regulating their expression of anger. And so because of this level of distress and functional impairment, it is important to actually work with a young person to manage these issues as soon as possible. We also know that when considering functional impairment, that anger has been shown to cause the most destruction to an individual's interpersonal relationship than any other emotion. I touched on before, but we do know that it's also associated with an increased risk of maladaptive behaviours, so greater risk of engaging in a wide range of problematic behaviours, and these secondary outcomes can cause additional significant distress and functional impairment as well. Young people who experience problematic anger in school were more likely to perpetrate dating and peer violence later on in life. And so it's also associated with increased suicidal ideation. And that relationship between anger and suicidal ideation is independent of the impact of depression and low self-esteem. So again, we're saying for young people who are showing signs of having problems with expressing their anger in their secondary schooling years, that it actually then goes on to increase the risk that they'll have some problems with violence later on. So again, intervening early can help prevent those longer-term consequences. And finally, we also know that problems with managing anger, experiencing intense and chronic anger, and also the expression of anger as aggression can increase the risk of a whole range of physical health problems as well. So people who experience chronic anger problems are more likely to have coronary heart disease later on in life, to develop type 2 diabetes, and they're also more likely to die younger than individuals without a history of anger problems. So all of these combined are sort of pointing the picture to say the earlier that we can detect that young people are having problems with anger and offer them some effective ways of managing that emotion and learning how to tolerate distressing emotions is really important to prevent these long-term consequences. So what's the evidence when looking at actually some intervention trials that have been conducted with young people who have anger issues? So we're actually pulling together in the middle of working on a systematic review, so we will have the results of this available later on in the year. But at the moment, the studies that we've identified tend to be psychotherapy trials. They tend to be quite small, and the majority have recruited participants from university settings. So they are having some problems with anger, but tend to be scoring above a cutoff on a screening tool or an anger or aggression scales. So some of these participants have been help seeking, but some were also screened through their research participation program at university as well. So we know less about what's actually happening in clinical settings, except there was a couple of small trials that have been done in specialised mental health services that are showing some positive outcomes of using predominantly CBT-based interventions with young people. And they also tend to be, more often than not, group-based interventions too. So one example of this is the Centre for Clinical Interventions, and you can find it on their website, has a therapy manual called Getting Along and Keeping Cool. It's actually a group therapy manual. So it's got some ideas in there of how to actually run some group sessions with young people who are having problems with anger. So what would we do if we're trying to offer some interventions to young people who are experiencing anger? And I'll just stop for a second. Sorry, I just need to have a drink. Thanks. So it's really important when you're working with a young person who has identified that they've got anger issues either themselves or it has been part of the referral process that others have been concerned about their anger, is to explore how and why anger is a problem for the young person. So to think about the intensity of the emotion, how frequently they're feeling it, and whether they have experienced or shown any inappropriate expressions of anger as well. So to get a sense of when that's happening. Also, it's really important to explain to a young person to think about anger as being a learned behaviour. So their response to it is a learned behaviour, and it can become routine in response to situations or activating events. And so what the work that you'll be doing together is to try to understand those situations or activating events, to try and interrupt it being that automatic or what feels like an automatic response to feeling that emotion. And it's also can be really useful to help with their motivation to change, to identify the consequences that the young person has experienced as a result of experiencing anger and also expressing anger as well. So it may well be for some young people that it's actually about wanting to reduce the reactions of others that actually encourages them or motivates them to start working on their anger issues too. The next step is to think about how to break that anger habit. So we're wanting to increase that awareness of events or circumstances or behaviours that seem to trigger the anger response. So that ABC model, so thinking about activating events, beliefs and consequences, can be really useful to look for common underlying features here. So it can help the young person to recognise, also to recognise that signs that their anger is escalating. So not only about those common situations or events that might trigger anger, but signs that they can look at within their body and to see that their anger is escalating. So some physical cues, they might be thinking about how if they're suddenly feeling hot or they're noticing an increase in their heart rate. Also to be talking about some behavioural cues, so they're showing or feeling some anger in their body by clenching their fists, by starting to pace or increasing the volume of their voice or shouting. Some emotional cues, and this may take a lot more time and a lot more work in therapy to actually see what are some of those emotions that underlie the building of anger. So maybe feeling rejected, feeling jealous or feeling humiliated in a situation as well. Those feelings may actually be some cues to actually experiencing anger and expressing anger. And some cognitive cues as well. So again, another thing that may take a little bit of work and time and engaging with the young person in thinking about this is their negative self-talk. Maybe they're more inclined to interpret comments as being critical and therefore more inclined to react in an angry way as well. One thing I did want to mention, which I don't think I actually have on any of the slides, so I'll say it now in case I do forget, is that it can also, in that way of working with a young person to realise that their anger is escalating, to think if it is useful for them to use a rating scale. For example, they might say, 10 is actually when they've actually, feel like they've lost control and their anger has totally got to that exploding point. And 0 or 1 might be when they're feeling pretty calm and in control of their emotions. And it may well be that what we're asking them to do in recognising the signs that it's escalating is to identify when it's starting to get up to, the 3 or 4 or 5 on their scale. So they still have a chance to actually try and use some immediate strategies, which we'll get to in a minute, to try and de-escalate that situation before they actually get to that explosion phase. So we're using this language because it's something that young people do identify with and understand in thinking about anger as having some phases. So I touched on in the previous slide about escalation. So that's the increase in those cues that are likely to increase the experience of anger. Then the explosion phase is the actual expression of anger. And then the post-explosion phase is the negative consequences that occur as a result of the expression of anger. So we can think about encouraging a young person to think about preventing anger, but also thinking about immediate strategies that they could use once they are recognising that they're early in that escalation phase as well. So that's when I was mentioning about sort of that rating scale idea of thinking when I get to a 3 or a 4, I need to actually do something now so I don't get to the explosion phase. And anger monitoring scales may be helpful to raise awareness of these cues. So for example, the hassle log can, and this is in that resource that I mentioned from the Centre for Clinical Interventions, that you can think about, when does it occur, looking at patterns across the day, what was a triggering event, who was the person involved, what were they feeling, what were the consequences, did they act on that anger, and then an idea on how intense were the feelings, and then whether the self-rating as to whether they thought they handled it okay or not. So for young people who are struggling to actually see some of those patterns, using a monitoring tool like this can be really a helpful start. So what are some of the strategies that can help manage the anger response? So thinking about some immediate situations that can avoid the expression of anger. So this is when a young person is recognising that they're starting to enter that escalation phase. So taking time out or removing yourself from a situation can be a very successful strategy. Doing something active, like going for a walk or a run, can also help in the immediate situation too. Doing some deep breathing exercises, focusing on taking long and slow breaths, or thinking about progressive muscle relaxation that they would have practiced as a prevention strategy, but to actually use it in the moment when they need it as an immediate strategy. Thought stopping, so thinking about saying to themselves, like, I need to stop these angry thoughts. I'll get in trouble if I keep thinking this way. Might be useful. And also self-talk, some sort of positive statements about saying, I can choose my own response to this situation, may also be helpful. So again, we can see a range of sort of physical, behavioural and cognitive strategies that young people may use when they're noticing that their anger is escalating. But like all of these strategies, they do need to be practiced as well to be effective. And then also think about pairing that up with some preventative strategies. So these are some things that young people can engage in regularly to help reduce their experience of anger. So engaging in regular physical activity can be really helpful. Some longer term work, like challenging some of those irrational beliefs, can be useful as well. So some of those thoughts that may be underlying anger, that, about feeling humiliated, feeling jealous, those sorts of things. Practicing mindfulness and other distress tolerance skills can help. And then also some behavioural and interpersonal skills might help as well. So, for example, working on assertiveness skills rather than aggressive communication, and other problem-solving skills too. It may well be that young people can identify that there are common situations or events that trigger their anger, and it may well be that helping them to express their needs to others can be really useful, and so just those general communication skills can help. So I'd just like to work through a case study. I haven't given much information here, but I'll explain as I go through. So thinking about Paul, who's just turned 16, and he was referred to a youth mental health service by his school welfare coordinator because he had some anger problems at school, expressing his anger that had resulted in a series of suspensions. And his mother was also concerned about some of the property damage he had done at home as well. So he was quite reluctant to come to clinical services, and it was mainly at the insistence of his school and his mother that he did come along for his first appointment. His parents were separated and his mother had repartnered, and he had 4 siblings, 1 older and 2 of the younger siblings were from the relationship with his mother and her new partner, and his younger sibling was diagnosed with autism spectrum disorder. So just to get a sense of quite a busy family, and that the younger brother had some needs as well. So in thinking about Paul and how he's functioning, I'd like to focus on what was he feeling, like what emotions was he experiencing, what was he thinking, what is his cognitions, how's he behaving, and what are some of the physical changes that he's experiencing as well. So this is loosely based on a CBT model for looking at anger. So when first working with Paul, he could only identify that he felt anger sometimes, and he didn't know what he was thinking, and he knew with his behaviours that sometimes he raised his voice or knocked chairs over or threw papers around the classroom when he was at school. And he also knew that he was aware that he had punched walls and broken some things at home. And in terms of physical changes, the only thing that he could identify was that at that time he felt really hot. So how did we approach our work together? So as I mentioned, Paul was reluctant to attend treatment. So he felt that he was managing okay, that he didn't have a problem, and it was other people's reactions to him that were the problem. So we worked on engagement a lot and trying to create rapport by spending a lot of time discussing his interests. So I learnt a lot about skateboarding, fixing cars, and we shared a lot of stories and photos about the hobbies that he did as well. And so once we actually had some tenuous rapport that had developed there, we were thinking about some psychoeducation, about treatment expectations as well. So he actually was treatment naive, and he actually thought that coming to manage his anger, which is how it was sort of described to him, would be that I would do something to him and to control that, rather than him being engaged in and working through treatment together. We actually then spent a bit of time to try and increase the motivation around identifying goals. So the biggest thing was not, at that point, Paul didn't say that he wanted to actually change how he was feeling, how he was expressing his anger, or other people's reactions to him. His biggest goal was to say that he wanted to actually get a part-time job so he could buy a car that he could fix up. But he wasn't allowed to get a part-time job at the moment because neither of his parents felt that he was able to manage that because of the behavioural difficulties that he was displaying with his anger. So we worked on that idea of saying, well, if we can look at how we can manage anger, then maybe you are going to be able to talk to mum and dad about trying out for getting a job. We used the ABC model and the hassle log to identify emotions that were connected with his anger expression. So we noticed from doing that he actually did feel a lot of times that he was unimportant in his family because of his younger sibling having special needs. And he also identified feeling very disconnected from his dad and that he was upset and sad about that. Some of the thoughts that he identified that were underlying his anger, experience of anger, was that boys or males should be strong, and this was modelled by his stepfather and older brother as well, that he shouldn't need help, and also this sense that he wasn't good enough. So he felt that there had been a long time with a very busy family, that somehow being sort of one of the middle siblings, that he had missed out on some attention and care from his parents, and also as a consequence of their relationship breaking up. And then also some of the difficulties that he was having at school. Felt again that it was that perhaps that he wasn't getting enough attention from important people in his life, and feeling that he was being overlooked. So we had a look at some of the immediate strategies to try and respond to the feelings of anger. So looking at some of those immediate cues that he was feeling. So over time we realised, yes, he noticed he was feeling hot. He also noticed that he had a lot of body tension. Some of the thoughts that he had was, I just need to get people to get out of my face. And also at school, that he didn't want to show sometimes that he didn't understand the work, and that would trigger some of that anger response in the classroom. We spoke about communication skills came in here because we realised one of the strategies would be he would need to talk to his teachers about how he was going to try and do things differently. So from doing the hassle log as well, we also noticed that an activating event was that first few minutes when a class started and everyone was coming in, and then that's when he would start to feel more and more tense, and then that tension would turn into anger, and that's when he would express his anger and then be asked to leave the classroom. So we're thinking of ways in which we could decrease that expression of anger and get him to actually stay in class. So he spoke, approached all his teachers and his welfare coordinator to talk about whether he could take an iPod into class to start with. So for the first few minutes, he would listen to music as the class was getting settled. He would also practice deep breathing, and then if he actually needed time out, he would say that he needed to get a glass of water, and he would leave the classroom and go off and get a drink and then rejoin. He also found that doing some physical activity at home was really useful too. Some preventative strategies we're thinking about was regular physical activity, so he started riding his bike more often, and then also in getting actually that part-time job eventually, so he had that sense of achievement and responsibility associated with that, and knowing that that he could achieve something that he set his mind to as well. And I mentioned the communication skills with teachers, but also he needed, we worked on communication skills with his mum and dad. So he worked on letting his mum know that he actually felt he needed to spend some time with her. He couldn't actually recall the last time he had one-on-one time with her. And so he negotiated to actually spend some more time with her, and they actually partitioned off an afternoon a week where she'd pick him up from school, and because he, as I said, was obsessed with skateboarding. He loved looking at all skater paraphernalia, and they would go window shopping together for a couple of hours and just hang out together, and he found that was really nice to have that time with her. He also negotiated to spend more time with his dad, because it was often used as a punishment if he was behaving badly to miss his weekends with his dad. So he talked about the ways in which he wanted his parents to acknowledge and notice the changes that he'd been making, and to reward him with being able to stick to those plans of spending time with his dad. And he was saving that money to buy the car to fix up with his dad and his older brother. So there was a lot of things that we were working on together that at the end of our time, he was able to identify some of those other emotions other than anger. So feelings of hurt, being left out, feeling inferior, and also sadness as well. So we're aware of some mood issues that were also underlying his anger presentation. We also identified those thoughts of male should be strong and I'm not good enough, and we worked on challenging those. He noticed that his behaviours, his anger expression behaviours decreased, and other changes in behaviour was the more time that he got to spend with his mum and dad. And the physical changes is that he noticed that he had a lot of tension in the body and excess energy, and so he worked on using regular activity as a strategy for managing that. Okay, so in summary, I'd just like to wrap up and sort of mention that before we get to some questions, that to remember that anger is a common presenting issue for young people, both males and females who are coming to mental health services. It may well be that it's something that they can identify, or it may be a concern of others around them. And that's why it's really important for us to do early detection and a thorough assessment of anger issues as well. We know that problematic anger is associated with a range of negative consequences, both other mental health consequences, functional impacts, and also physical health consequences as well, including the increased risk of suicide and self-harm. So it is really important to inquire about and detect problematic anger so we can actually manage and deal and deliver effective interventions for those associated negative consequences too. And so some effective psychological treatments really tend to include predominantly CBT-based interventions, and to remember to include strategies that help manage the escalation of anger responses, but also to prevent them as well. So it's a dual approach. We've got some short-term, in-the-moment strategies to help a young person become better equipped at using, and then also those longer-term prevention strategies that we can include in the work that we do with them as well. And I'd just like to mention that we have got just available today, actually, a couple of new resources that are available on the Orygen website. So these unpack a little bit more of what I've been covering in this webinar today. So the evidence summary is a guide for clinicians, and it contains a lot of background information about understanding and assessing anger-related difficulties in young people. And we've also put together a myth buster about highlighting some of those myths that I touched on in the webinar as well, and how they may actually act as barriers to young people engaging in services or getting the right help. So we've done a myth buster around some of those common myths about anger too. So they're available today on the Orygen website. Okay. Should we go to questions, or did you want to talk?
We do have some questions that have come through.
Excellent. So just wanted to remind you that the webinar has been recorded, and you will be able to find it on the Orygen website at a later date, and also the information, but I'll get Karen to talk about that in a moment. So I might just go back to this slide and we'll have a look at some of the questions that have come through. Okay. So I've got a question about what do you think is at the root of young men having more anger than young women, and is it more likely to come from certain subcultural groups? and rather than seeing more anger, we're seeing less emotional repression? It's a very good question, and I think that in some ways what the research is indicating is that there's no difference in the way that males and females experience anger. So it's an emotion, and it can be a healthy emotion, as we talked about, and it can also be a problematic emotion. And what the difference can be is that males are more likely to express it in an aggressive way than females. And then also both males and females are equally inclined to use relational aggression, so manipulation behaviours or other things in relationships as well. There is some thinking that's saying that the reason why that young men are more inclined to express anger with aggression is based on some of our cultural norms. So young women or girls tend to be socialised in a way of thinking that that girls are more emotionally expressive about positive emotions, and that boys tend to be encouraged to hide some of those and to actually be sort of tougher and stronger, and as a consequence of that, maybe more inclined to show aggression when they're feeling angry. Okay, so are there any major differences in working with young people with different gender, so with males or females? On the whole, there hasn't actually been enough evidence to show whether we need to have gender differences in approaching treatment with young people. So I think probably the most important takeaway message is about identifying or detecting when there's anger issues, and then working through ways in which they can, some immediate and sort of preventative strategies that young people can use to manage that, to actually get a better understanding, to avoid that explosion phase, and to get a better understanding of how they can manage that escalation phase as well. So I think, so long answer to a short question is that there's not enough evidence to show that we need to have gender-specific treatment approaches. There certainly is a relationship, so we've got a question about relationship between anger and substance use. There definitely is, so the literature does show that in and of itself, people who use substances because of the disinhibition effect may be more inclined to express a whole range of emotions, with anger being one of them, and have a whole range of behavioural responses that can get them into a lot of trouble. But if we're thinking about from the reverse of saying that young people who are having difficulties tolerating distressing emotions, having difficulties managing their anger expression, there is definitely a relationship with substance use. They may be inclined to use substances as a way of trying to manage some of those distressing emotions, as we know that that happens across the board with other mental health problems that young people are experiencing. But also it may well be that those who already have a problem with aggression and expressing their anger, that having using substances may make them more inclined to be more aggressive more often, and seem to have sort of a lower threshold for triggering events as well. So I've got a question about traumatic brain injury, and I'm not actually certain about that area, so I can take that question on board, and we'll be able to respond to it at a later date on the feedback on our website. Just see whether anyone else has any more questions that are coming in at the moment. There's a question about anger and links with high levels of family violence that we do see in Australia, and that it may, and the person suggested that it's a neglected area. If we don't address this early, we'll still have this epidemic. I think that based on some of the research that we do see that there is that link between, because anger expression is a learned behaviour, that if someone has seen that and it is modelled, that it may be more likely that they will use that as a method of dealing with their anger emotions as well. And it is very important for all people, or everyone, to be able to think about how we actually can see anger as being a healthy emotion, and learning how to manage it appropriately is really important for our own mental health and well-being, and for the safety of those that are around us as well. So I think that there is some ways of thinking about that with a lot of issues that have social determinants behind behind them, that we do tend to work individually with people to help them with their specific issues. But yes, we do need to keep in mind that there are broader societal contexts as well, and to keep that in mind in some of the research that we're doing. Okay. Question about whether if we know anything about the relationship between anger and successful relationships in young men. I'll think about that one as well, but we certainly do know the reverse. So we do know that young people who have some problems with anger in their early adolescence or in their high school age years are actually, there is a strong association that they're more inclined to actually exhibit, dating violence and violence in relationships at a later date as well. So they're at higher risk of being perpetrators of violence later on down the track. So there is certainly a link with that early experience of intense and chronic anger and how it affects relationship issues. Okay. Well, I think that might be the end of the questions coming in, so I might hand over to Karen now to wrap up.
Okay, thank you, Alex. That was really informative. I think we have had questions that sound like they may have come from families and also from people who are working with young people. I think anger is such a common issue, and we often are faced with it, and it's very useful for us to pause today and have a think about how we are managing both with the young people we know personally and for those of us who are working professionally with them. So I'd like to thank Alex for her time today and for assisting us to think about this issue that we see quite commonly. Okay. We wanted just to make mention that Orygen have partnered with the Young and Well Cooperative Research Centre on a very exciting educational set of modules that people who are working with young people in mental health settings and in community settings might be interested in. Young people these days are moving very quickly into their use of technology, and some of the older clinicians and people working with them are having a little bit of trouble keeping up with the changes. It's difficult for us to be reaching all of the young people that we need to reach individually in face-to-face settings these days, and technology is a way that we can both increase our access to young people and assist them with their treatment, but also it's what they're using themselves. So if you're interested in learning a little bit more about how you use technology in your treatment of young people with mental ill health, you might be interested to have a look at modules that have been developed with the Young and Well Cooperative Research Centre and Michael Carr-Gregg, and you'll find them on the Orygen website. And we also wanted to let you know that we have, after a short break for Easter, some more webinars coming to you. In April and early May, we'll be having a think about topics such as eating disorders in young people. We have a webinar specifically for people who work in education settings and who are struggling with issues around self-harm that we know are quite prominent in this age group. And in May, we have a webinar entitled Sport and Mental Health in Young People. So this is a topic specific for people who are volunteering or working in sporting sectors, thinking about how they might be able to identify and respond to young people who might be presenting with mental health difficulties. So if any of those topics interest you, do come back and see us for those webinars in late April and early May. Okay. Thank you for your time. I hope you got something out of today, and we hope to see you again for another one of our webinars.